out of respect for time. We'll go ahead and get started, but before we do have the honor of having this webinar be co-hosted alongside ARCA, and we do have the current ARCA past president on as well, Michelle Bradham-Kuser, and I know that she wanted to say a few words before we get started as well. So Michelle.
Thank you, Daniel. And thank you, everyone, for being here. I truly appreciate each and every one of you that are interested in knowing more about individuals with disabilities. In regards to ARCA, as Daniel has already shared, I'm currently the past president of the American Rehabilitation Counseling Association, and our goal is to make sure that we can have a diversity of individuals to hear about how to have a complete therapeutic intervention for individuals with disabilities. And I'm glad that we're looking at it from a multicultural perspective so that individuals can have that cultural awareness so that there will be a cultural response within all communities. And thank you, each and every one of you. If you have any questions, or if you would like to follow up on anything, or if you need further information, what we can do, you can reach out to Daniel and we can make sure that we can provide that to you. And any of you guys that are going to ACA, that is in a couple weeks, we will have some additional sessions in regards to providing therapeutic intervention for individuals with disabilities. And thank you, and I hope each and every one of you enjoy. Thank you, Daniel.
Absolutely, and thank you, Michelle. So before we get started, again, I would just like to say on behalf of the Florida Association for Multicultural Counseling and Development, we do want to thank each of you for attending tonight. We're very excited to have this webinar hosted by Maria, and I'll speak just a little bit about her in just a moment. But before we get started, I would just like to bring up a few additional upcoming webinars that our division will be hosting in the upcoming months. On Thursday, March 21st at 12 p.m., we'll be hosting a webinar focused on ambiguous loss and migrant families. On Friday, April 26th from 12 p.m. to 1:30 p.m., we'll be collaborating with the FACES division and hosting a webinar focused on multicultural development, considerations, and counselor education and supervision. And on Friday, May 24th at 12 p.m., we'll be hosting a webinar focused on culturally responsive calculations, considerations when administering assessments. We're really excited to have Maria here tonight to kick us off with our webinar series for the 2019 year. So Maria Davis-Pierre is the founder of Autism in Black Incorporated. She is a therapist, a coach, speaker, author, and advocate. After going through the process of getting her daughter diagnosed at 18 months, Maria changed her specialty and began working heavily in the autism community. In January of 2018, Maria launched her second private practice, Autism in Black Incorporated, which aims to provide support to Black parents who have a child on the spectrum through educational and advocacy services. Autism in Black Inc. is dedicated to bringing awareness and acceptance to the autism spectrum disorder and reducing the stigma associated with the ASD in the Black community. Maria is a licensed mental health counselor in the state of Florida. She graduated from Florida State University with a Bachelor's of Science in Sociology and went on to obtain a Master's of Science in Mental Health Counseling from Nova Southeastern University. Maria is currently working on her PhD in Family Therapy from Nova as well, and she's the current secretary for FAMCD. And as a side note, Maria is just an incredible individual with a wealth of knowledge. So again, we're truly honored to have her here tonight presenting on such an important topic. So with that being said, thank you all for attending. We're really glad to have you here. And thank you so much, Maria. And if you'd like to take it away.
Thank you, Daniel. I'm so excited to be doing this webinar. So for the sake of time, we're going to get right to it. So let me start the screen share. Okay. So welcome to the presentation on autism and the Black family. You've already heard a little bit about me from Daniel, but to speak a little bit more about me and Autism in Black Ink, I have a 6-year-old daughter who is autistic. She was diagnosed at 18 months after a extremely lengthy process. And after getting her diagnosis, we kind of thought that that was, the hardest thing. We've gotten through it. Now it should be easy street, not knowing that was just the beginning of our journey. And what I began to take notice with the professionals coming in and out of our home to provide therapy services for her is that, one, they never took the culture of me and my husband, I'm Black, my husband's Haitian American, into consideration. They never thought to incorporate our culture into therapy services, nor think about the impact our culture could have on therapeutic services. Also, they didn't provide support to us as parents or really talk to us as the parents of the person, being around the child 24/7. So it was kind of just focused on her and their treatment planning and stuff. And in talking to my circle of autism parents, I found out that this was more of a norm. So taking that into consideration and the fact that I, as a mental health professional, and my husband as a physician, had such a trying time with getting our daughter diagnosis, and wondering, about those who didn't have the resources we had or the knowledge we had and what they had to go through, I started Autism in Black Ink, which, as Daniel said, is to support Black parents who have a child on the spectrum, as well as to train professionals on cultural competency when it comes to the Black families and disabilities and special needs. So getting to our training objectives, first we're going to talk about cultural factors that interfere with identifying and serving Black children with autism spectrum disorder and their families. We're going to discuss the role of collaboration in fostering cultural sensitivity of clinicians. And then we're going to take key points from a Black family's culture and apply it to their therapeutic style to work more effectively with these families. Take note, this is usually a 3 to 4 hour training for me. So to condense it into a 1 hour training, we're going to kind of just touch the surface on stuff, especially when it comes to objective 3. I feel that objective 1 is extremely important, so we're going to spend a lot of time on that. Also, I'm going to take questions at the end of the presentation, so feel free to utilize the chat with any questions that may come up, but no, I'm going to check it at the end of the presentation. So I like to get started with what is autism, so we have a basic understanding of that for the presentation. So autism is a neurodevelopmental disorder that is characterized by difficulties with communication, so speech regression or speech delay. Difficulties with sensory. I know that sometimes people may see an autistic child out and think they're having a tantrum, but what really is occurring is a sensory overload. So they experience bright lights, sounds, textures, smells, things like that, much greater than neurotypical people do. And neurotypical means those who don't have any kind of neurodevelopmental disorder. Cognitive impairment. So you can speak to a person who is autistic and they can tell you anything about history, or if that's their thing, or anything about dinosaurs if that's their things, but may not understand how to add 2 + 2, or may not understand how to tie their shoes. Social impairments. So, they are not able to read social cues, not understanding, how to have a conversation with, back and forth, and understanding the other person's interests, or understand, if the other person is sad or happy, and reading, the body language. So also repetitive behaviors, things like hand flapping, or turning in circles. My daughter likes to turn in circles. Also, repeating what you're saying. So if I say, oh, the sky is blue, and then they say, oh, the sky is blue. Or if I say, oh, the grass is green, and they say, oh, the grass is green. So just repeating that. And most importantly, knowing that autism is a spectrum disorder. So knowing that no two individuals who are autistic are the same. They all experience autism differently. And also noting that, we a lot of times use the terms high functioning and low functioning when it comes to autism, but also knowing that those who are high functioning still have struggles and still have to, put forth a lot of effort to use those coping skills. Just because they're high functioning doesn't mean they experience autism on a lesser scale. So why does culture matter when it comes to autism? Cultural sensitivity is necessary in identifying, assessing, and providing services to children with ASD. We have to take into consideration their culture, because it has an impact on not only them getting the diagnosis, but the diagnosis itself and the treatment for the diagnosis. The core symptoms of ASD affect social and communication skills, and to some extent, these skills are culturally determined. So I know a lot of times, eye contact is, something that healthcare professionals use to determine, ASD. But in some cultures, you don't make eye contact. So it's good to know these cultural factors when diagnosing autism. So we are going to address 3 cultural factors during this presentation that can interfere with the autism diagnosis. There are many more, but for the sake of time, we're going to touch on these 3. Race and ethnicity, family beliefs, values and religion, and economic status. So starting with race and ethnicity, to date, there is no research that claims ASD occurs less or more in one race or an ethnicity than in another. However, there is a 2-year gap between when a white child is diagnosed and when a Black or Hispanic child is diagnosed with autism. A lot of this does have to do with their race and how healthcare professionals perceive those who are Black and Hispanic. A lot of healthcare studies have shown a lot of healthcare professionals don't believe that children who are Black can be autistic. They don't want to have, or if they see the signs in the child, they don't want to have the conversations with the parent because of their belief surrounding the parent's level of education or understanding, so that they don't want to get caught up in a conversation that they don't think the parent is going to understand. So with there being a 2-year gap between getting the diagnosis, this results in services being received at a later time for our Black children. And we all know that early intervention is key when it comes to autism. The 0 to 3 age is a real prime time for them to gain skills that are going to help them later in life. And when we're dealing with a 2-year gap overall, and so when we're saying overall, that means in some states the gap is larger. I know in one of the states, one of the ambassadors was saying they have a 6-year gap. So, that child is already in school. They're in second grade by then. And by that time, a lot of time has passed. And when providing services, there's just some times that we're not going to be able to make up for. So that affects the child. Black children are more likely to be diagnosed with a behavior or conduct disorder before ASD. Healthcare professionals are more likely to see ADHD or ODD before they think autism. So again, this leads to misdiagnosis. This leads to wrong services. And when we get to the actual right diagnosis, there's a lot of time that has passed. Also, Black children are more likely to have a co-diagnosis of autism spectrum disorder and intellectual disability. They're also more likely to be on the lower functioning side of autism. So, family beliefs, values, and religion. Differences in parent knowledge, beliefs, and concerns about overall child development and developmental delay can lead to the gap in the diagnosis. Black parents report fewer concerns about behaviors like delayed speech and repetitive behaviors. They don't They're less likely to go to the doctor with these concerns. And even then, when they do go to the doctor, if the doctor is not knowledgeable about autism, because that's another issue, healthcare professionals aren't really knowledgeable about autism. Your regular pediatrician does not diagnose autism. A developmental pediatrician, a child psychologist, a child neurologist, and a child psychiatrist are the only people that can really diagnose autism. So your regular pediatrician may not have that knowledge. So if a Black parent was to go and say their concerns, and if the pediatrician was not knowledgeable and was like, oh, well, let's wait a while, the Black parent would be more likely to take that and say, okay. Because culturally, we're taught to respect those in high positions, somebody with a medical degree, who is a professional and has went to school. We're taught to say, okay, they know what they're talking about, rather than press the issue or get a secondary diagnosis or a secondary opinion. So also parental recognition and concerns about the symptoms of autism are not consistent with nor across ethnic groups. Also take into consideration that with Black families, the children are a lot of times watched by family members. And, a lot of times the family members are not looking for developmental delays. They just want to make sure the kid is fed, happy, and, gets to mom at the end of the day. And, so they're not looking for these signs and symptoms. Also, if they do notice them, they're more likely to say, hey, give that baby time to catch up, don't put so much pressure on them. In their own time, they will do it. And we're more likely to listen to that and, take that time to give them to catch up, not knowing that it could be a sign of autism or any other developmental delay. For Black families, having a child with a disability could be seen as a punishment for sins. So I know of one particular family who went to their pastor to talk about their child's diagnosis with autism. And the pastor said, we're going to pray for your child. We're going to lay hands on your child. And we're going to pray this autism out. Of course, the autism didn't go away. And when it didn't go away, the pastor then told the family, this is because of your past sins. Your child is being punished for your past sins, and now they have to live this way, and you have to accept it. So when it comes to religion, which is a core value in Black homes, not for all, but, across culturally, religion plays an important part in Black families. So when you go to your pastor and you're telling them this and he or she tells you that, then you're like, okay, well then this is the punishment for my sins. There's the shame and the guilt that comes along with that. Also, the acceptance of a child with a disability can be seen as a gift from God. It can mean that, it's a means of helping or serving for the Lord. Religion helps parents maintain a sense of hope, and also helps them with acceptance. So they place a lot of value onto that. Family members, church members, and friends serve as a support circle. So Black parents are more than likely to go to these people in their support circle first before they go to any professional or outsider. So if the family members or the church members and the friends are saying, no, we're not seeing that, or they're saying, no, the doctor's wrong, or they're saying, we're going to pray about it and we'll keep it in prayer, they're more likely to listen to that group of people rather than an outsider who is saying, hey, let's get these supports in place. Let's do this, this, and this. And also, due to the importance the community members play in our lives, if they think that the child is not properly disciplined, this can be seen as shame. So because your child is acting or perceived as acting out, having tantrums, not listening, is a picky eater, they're thinking they're just not properly disciplined. So you've failed as a parent, and a lot of shame sets in with that, and then parents don't seek out services. So, keep those things in mind when it comes to, the belief systems, the values, and religion when you're working with, Black families who have a child who is autistic. Also, economic status. So, underinsured or uninsured altogether. A lot of times, they don't have a consistent primary provider. So if every time that I'm taking my child to the doctor, they're seeing a different physician, then the physician may not catch the signs and red flags of autism because this is their first time seeing the kid, and they may not have time to read the chart, and they're just coming in to help with whatever the presenting problem is. Also, take into consideration that when it comes to autism, we're looking at an average of $60,000 out of pocket for those who are insured. So that's $60,000 in therapy that is coming out of pocket for those who are insured to help with paying for ABA therapy, speech therapy, OT, physical therapy, and all of that. And I mean, who has $60,000 just lying around to, help with these services? And then when it comes to the medical side of it, it's an average of $12,000 that is coming out of parents' pockets for those who are insured. So $12,000 is going into medical expenses. And the reason that is so high is because, children who are autistic lack a sense of danger. They also, studies have shown there's attraction to water, so there's higher risk for, things to happen to them because they lack that sense of danger, things to tell them that, okay, I shouldn't do this, or, I shouldn't get close to the water. Getting hit by a car, things like that happen, and then parents have to deal with that medically. Job flexibility. Parents may be in the position where they cannot take off for multiple appointments. So their child can't get all the necessary screenings and appointments that go along with having to get diagnosed. You don't just get diagnosed in one appointment. It takes a lot of testing, a lot of rollouts, especially, depending on the professional that is doing the work. If it's a neurologist, there's a lot of DNA testing that's going on. That's extensive and expensive. If it's a psychologist, they're doing a lot of, evaluations that may not be able to be completed in one session because of the lack of attention span the child may have. And the parent may not be able to take off for all of these appointments. Also, developmental concerns versus economic needs. If the parent is, living check to check, economic needs are more than likely going to trump developmental concerns. Also, if they're working these long shifts, they may miss the developmental concerns. So if their child is, going to school, then going to aftercare, then you get home and it's time for, bath, dinner, and bed, they may be missing these red flags and these symptoms that are autism because they're just getting ready to do it all over again the next day. So again, economic needs trump developmental concerns in a lot of cases. Also, having to deal with micro insults and microaggressions. So dealing with being dismissed or not being listened to by healthcare professionals. As I was saying, studies have shown that doctors don't want to have the conversation with Black or Hispanic moms because they don't think that they have the level of education to understand what autism is. So they rather not even start the conversation and rather let them get diagnosed in school or somewhere else where they don't have to take the time out to have that conversation, when they have these 15-minute time slots to see a patient. So they have to, they're underestimated. Their level of education and their level of understanding is underestimated. So what can we do with all of this information? Of course, we want to be culturally competent. And how do we do that? One is that we work on having a set of values that recognize diversity. We want to demonstrate behaviors, attitudes, policies, and structures that enable us to work effectively, cross-culturally, and also value diversity. We should always be conducting self-assessments of ourselves to ensure sensitivity to cultural characteristics. It is extremely important for us as therapists to be honest with ourselves and honest with our own set of cultural values and what we learn and our biases, because if we don't check them, then they will show up in the therapy room. We want to be committed to manage the dynamics of difference. We want to learn about and incorporate cultural knowledge into our practices. And we want to be able to adapt to diversity and the cultural context of the communities that you're serving. So your role as the mental health professional is as an advocate. You want to support the child and support the parent. With supporting the child, you always want to be thinking of the child's best interest. You want to be doing collaborative work. I know a lot of times we don't get paid for everything, but it's so important for us to collaborate with the other people that are in the child's lives, meaning the other healthcare professionals, meaning the schools, especially if the child is school age and they are autistic. More than likely, they're going to have an IEP, which is an individual education plan, meaning they are getting special education services. So that means they have a document that the school goes by of what goals that child is going to be working on to be successful. So you knowing what those goals are and having kind of a collaboration of what is going on in therapy, that way the child is getting these services, in different areas, and everybody's working on the success for this child. Checking in with the child, a lot of times we think that because the child is autistic that their level of understanding isn't that great, so we make decisions for them rather than with them, and that's at a disservice to the child, because a lot of times they do know what's going on. Just because they are not able to verbally communicate it doesn't mean they don't know what's going on. So checking in with them, asking them what goals that they want to work on or what's working for them, just keeping them as a part of their treatment, supporting the parent. So checking in with the parent. Remember, I was saying that for me and my husband, the professionals that were coming in and servicing our child, they never checked in with us. They never talked to us about, the treatment she was getting, so that we could also, be doing some of these interventions outside of the hour that they were seeing her. As we know, there's more than 1 hour in a day. So knowing that we're with them for extensive periods of time, including us, helps you as a mental health professional and makes your job easier if we're helping and working on it together as a team. Being aware of potential triggers for parents. So culturally, being aware of things that can upset the parent, being aware of, religious factors that, play a part, and knowing that the parent may not be resistant, as we like to label them, but rather dealing with the struggle between religion and therapy, not knowing that it's not an either or, but a both and sort of thing. So a lot of times for parents, Black parents, their religion is telling them, no therapy. So to have someone come in and be providing these resources is a struggle, because we're taught to take our worries and our troubles to the Lord. And then here we go, not trusting the Lord and having someone else come in and provide these services to our child. So knowing that it could be a struggle that the parent is dealing with rather than resistance. Being a source of support for the parent. Being aware of those triggers, being aware of that, the pity that we want to give a parent because their child is autistic, or saying that, oh, thank you for taking care of your child. Thank you for loving your child, even though they're autistic. That's a potential trigger for them, because they should love their child. They should take care of their child, even though they're autistic. It doesn't make them any difference in the love and support that they're providing in regards to their neurotypical children versus their autistic or developmentally delayed children. So just knowing these things when you're providing services is extremely important. So I want to talk about some of our therapy skills that we use when working with a family. So we all know how important joining is, building the rapport. We know we can spend, the first 2 sessions joining in and building the rapport. But for Black families, know that the joining and building rapport process can be extensive. One, because of the field that we're in, being a therapist, a social worker, to them already sets them at being uneasy, because they're used to those people being the one that take the children away from them or file reports on them. So, they're always thinking of, okay, well, what is your true motive for being here? So, knowing that trust is just not going to be readily handed to you. Also knowing that if you don't look like them, meaning if you're not Black, then, there's a long history that comes with you, and they're not going to be trusting outright to you, as a possibility. So knowing that, you're going to have to kind of prove yourself to be able to create this alliance of trust with them. And knowing that the joining process can be extensive and can take time, we want to postpone a lot of the information gathering that we're doing. Meaning that, yes, they come in with the presenting problem, and that's, kind of what the spotlight is going to be on. But as we all know, as mental health professionals, the presenting concern is the tip of the iceberg, is what we see, but everything beneath is what is kind of playing a role in that presenting problem. But what comes with all of that is unpacking all of that information. And for a Black family, that they need to have trust to be able to do that with you. They have to be ready to do that. Therapy isn't something in our culture that we're just readily, ready to go to and be there and sit and tell all of our problems. So knowing this and knowing that what can come up when you're digging deep, below the surface and unpacking that, the Black family may not be able to deal with that. And knowing that when, certain truths come to light, they then have to set boundaries or, come to, a sort of, I guess they have to realize that what's going on with them, and take these truths as truths. So knowing that, we have to postpone the information gathering and have it done in segments over a period of time. And then with home-based therapy, especially when you're coming in to see the child and not the parent, you're there to provide therapy for the child. There's a lot that goes into play with that. One being because it's intrusive, or can be seen as intrusive, that you're coming into their home to provide the therapy. There was two incidents I can think of with fellow therapists. One came in the home, great therapist. She noticed shoes by the door, but she didn't take her shoes off. And, she walked around the house in her shoes. Even though she was a great therapist and doing good work with the client, the mom saw it as a sign of disrespect and didn't want the therapist to come to her home anymore. There was another incident where a therapist was seeing the client, providing therapy services in the client's room, and the client had a potty accident. The therapist, took it upon herself and changed the client, cleaned up, got the client another outfit out of the drawers. And the mom saw it as snooping. She didn't want the therapist going through and doing all of that. She wanted her to come and get her so then she could do these things, and felt that that was intrusive. So being aware of the culture of the home and what you're coming into, knowing that you can be seen as intrusive, and knowing that somebody may be, always looking and seeing what you're doing because they're not trusting you yet of what you're doing in their house. They may be asking you personal questions about your own life outside of being a therapist because of, you're in their home asking them questions. So these are things that we definitely want to take into consideration when we're providing therapy for Black families, and knowing that with them having a child with a disability, there's a lot of shame and guilt and frustrations that come along with that, because this is new to them. They don't know what necessarily to do. And in our culture, with the gap in services, there's also a gap in the information getting to us. So the families may not even know truly what autism is and what that truly means for them and what they have to do next. So, they may be feeling overwhelmed and frustrated and dealing with all of these emotions, and you may just be the person that is getting it. You're the person that's getting the anger and the frustration, and they're not meaning to give it to you. They just don't know how to express what they're feeling. So I wanted to end the presentation here and take a moment to look at the questions and go through the questions, because I know it's a lot of information that I talked about. So let me get to the question box. So if you have any questions, make sure to type it in the chat, and I'm going to start going through the questions. Okay. Was everybody able to hear me? I know someone said they were having a problem with audio. If you have any questions, just type them in the chat. Thank you, Christy, for that. Any questions, just type them in. So we have recorded the presentation. I think we're still deciding, how it will be available. I think everybody who signed up for the presentation will get the recording. If not, Daniel, correct me on that. But I think there was talks about sending the presentation to everybody. Yes, Hispanic families do have similar issues in that 2-year gap. They're also included in that 2-year gap. Something else that Hispanic families actually also have to deal with is the language barrier. And so that's an added factor in for Hispanic families, but they do face a lot of the similar issues with religion. There's also when it's the first male in the family and they're diagnosed with autism, the fathers seem to have more of an issue with that. So that's another issue that Hispanic families may have to deal with. Yes, I do have handouts or information that I can pass to parents. You all can go to my own website, which is autismandblack.org, and there's information for parents on there. And thank you, everybody, for coming, and have a good evening.